Good morning, everyone, and thank you for joining the Clallam EDC Coffee Chat, Coffee with Colleen. We are really excited to have our friend and partner, Wendy Bart, on with us this morning, and she is going to be talking about her biggest passion, I'm sure, YMCA, and what they're doing in the recreational space, but also in the childcare arena. And so just a few housekeeping items before we kick this off. If you'll put your Zoom on mute so we don't inadvertently pick up any background noise. And if you have any question to ask Wendy during her presentation, we'd like this to be as interactive as possible. So please feel free to raise your hand, or you can put your question in the chat and we'll get to it when there's a break in the presentation. So with that, Wendy, thank you so much for joining us, and please take it away. I know you have slides, so
yep,
go for it.
Well, thanks for having me. Let me get ready here so I can share my presentation. Let's go here. Hang on. Okay. All right. Just assuming everyone can see my screen. Yes?
Yeah. Do you want to do the slideshow and start from the beginning?
Yes. Is it actually, hang on, should show, or is it showing in presenter mode?
In presenter mode.
Hang on. Let's see.
Or the rather not presenter mode. It's the, version. I think you want to go from the beginning, click that left button.
Well, yeah, hang on, it's because I've got a dual display. That was what I was afraid of here.
Let's see. Sometimes an option at the top, Wendy, to swap views at the very top of the
let's see. Video. Here we go. Normal. No. I'm not. Let's see. Normal. Well, I'm not seeing anything to get out of this mode. Hang on. I'm going to stop sharing for a second. Oops. And it's exactly what you don't want to have happen, right? When you're doing presentations. So.
Happens more often.
Well, the good news is this has never happened to any of us before.
I'm sure. So
never had this happen.
Good morning, Carol.
Good morning. Sorry I'm late. I'm excited to hear from Wendy.
Okay, let's see if I can do it now. Okay. Hopefully. Hang on. Well, what I might do is disconnect from my multiple displays and see what happens.
Well, we've still got folks joining us, so
Hey, Colleen, it's Rebecca. Do you mind if I say good morning to Phyllis and congratulate her on her appointment?
Yes.
To PUD.
Her selection. Yes, that's exciting.
Thank you. Appreciate it so much. Yeah.
We really enjoy working with the PUD. We have an office space there, which is really helpful.
Okay, are we in business now?
Yes.
Can you see my screen?
Yes, we are.
All right. Okay, perfect. So thanks for having me. Sorry for that technical difficulty, but I do want to share a bit about what's been happening with the YMCA. And for those of you that aren't aware, I ended up here on the Peninsula in February of 2020, and I will never forget my start date, February 3rd of 2020, came as the interim CEO. And when I got here, I thought, the theme is really, this is all about stability and holding the Y together during this transition period. And, 6 weeks later, the world really turned upside down with the pandemic. And I found it actually a very insightful time to come to the Peninsula, to really determine and look at what are the community needs and how could the Y support the community during a really challenging time. And for anybody that knows me, I really love YMCA history. And so when COVID hit and everything was turned upside down, I spent some time looking at, what has the Y's response been during different periods of time. And so, shoot, I'm having trouble here. Let's see. Advancing my slides. How is that happening? Here we go. Okay. So again, the Y is this year 180 years old. The Y started in 1844 in London, England. Actually was established by someone who was 22 years old, which I find really amazing. But over the course of time, the Y has adapted and responded and changed and evolved. And again, when the pandemic hit, and I was really looking at what could this moment in time mean to the Y? It was helpful to reflect and look back on what the Y has done during things like the Industrial Revolution, World War I, the Spanish flu epidemic. And the Y has consistently evolved and adapted, and many things had their origin in the Y that ended up kind of spinning off and becoming their own entity. You might not be aware, but United Way had its origin in the YMCA, the USO, Campfire, Scouts, even the first pro football team started at the YMCA. And so, again, to me, it was this opportunity to look at what was happening due to the pandemic that might be a call to action for the Y to clarify what we were doing, to clarify our priorities, to clarify our response to gaps in the community, and what might we do in response to that. So I found the pandemic a really clarifying moment for our YMCA. And as part of that, we've ended up actually revising our mission statement. We adopted an equity statement and have revised that equity statement. And we've come up with 3 really important strategic priorities for the Y to focus on right now. One is that children are confident, they're prepared to learn, and that they care about others. We believe in creating a caring community that starts with children, that individuals of all ages are supported on their health journeys, and that individuals and families of all types are part of a really well-connected and supportive community. So our response out of the pandemic, to me, ended up having these very common threads around helping kids be confident, prepared to learn, helping all people focus on their health journeys, being healthy, having great quality of life, and then that our individuals, families of all types are part of a really well-connected, supportive community. One of the things we realized during the pandemic is that people who need access to support and services often are the people who are the least likely to be able to access them. And so realizing that people might not be able to make it to a food bank or make it to other support services, we ended up realizing, gosh, we need to find a way to get to people, to meet people where they are. That was one of our big learnings out of the pandemic, was finding ways to provide support and services to people who are the most challenged, most removed from being able to access support services. The other thing that we realized, and this was a very community-driven response, was realizing that for families, there are in our communities a myriad of support services, but to try to navigate those services, to try to figure out where to turn, can be really confusing. And so thinking about putting kids and families in the center, finding ways to bring support services and resources to the family instead of the family trying to figure out where to turn, where to go. And I would say the common theme, a really common theme that came out of COVID, was this idea of a resource navigator. So out of COVID, we've established a team of youth and family resource navigators who can serve as a hub for specifically helping families get access to the support services that they need. We have youth and family resource navigators who focus on community outreach, going out into the community, again, focused on people who are the most challenged in terms of accessing resources. We have youth and family resource navigators who are based in the Y, knowing that we've got families coming to the Y that are in need of additional support services, but again, don't necessarily know where to turn. And soon, we will have a school-based youth and family resource navigator in Sequim, based on a request from the Sequim School District to help kids and families access the resources and support they need. This has been, of all the things that came out of COVID, to me, this is one of the most effective, needed, relevant resources, is this the concept of a navigator. And I know more and more social service organizations are adding in and creating this concept of a resource navigator, so much so that actually I think we need to help navigate the navigators to keep us all really coordinated and working together to leverage community resources. But this has been a super effective way of providing support to communities. So the last thing that really came out of COVID, which was an issue for our community even before COVID, was childcare. And I think during COVID, it was this exclamation mark on how critical childcare is to our community ecosystem. You were seeing articles in Time Magazine, in the Wall Street Journal, in the New York Times, in the Washington Post. I mean, all kinds of articles around the childcare crisis and how critically important childcare is to our communities. As somebody who's been in the Y for almost 40 years, I've understood and known how critical childcare is for working families, but I think COVID really illuminated how integral childcare is to economic vitality, to economic recovery, to helping families stay in the workforce and or re-enter the workforce. So childcare, probably of everything, has been the one huge focus for us, is figuring out how we might support the childcare needs in the community. So just so you're aware, there's a really amazing interactive dashboard that the Department of Children, Youth, and Families has on their website that can highlight for you, for anyone. You can go and look by zip code, school district. You can drill down by income levels and age groups. What does the childcare need look like in our communities? And I would say for the Olympic Peninsula, we were classified a childcare desert even before COVID, which means the need for childcare is significantly higher than the availability of childcare. But this map kind of highlights, darker the red, the more significant the problem. This map really highlights the dearth of childcare in our communities and is really illustrative of what we need to be focused on in terms of helping people, helping to address this need. During COVID, our area, the Olympic Peninsula, lost either temporarily or permanently 25% of our childcare providers. And I know Colleen has been a huge champion for focusing on how to increase the number of childcare providers, helping to support family home childcare providers. There's all kinds of childcare providers. We need to lift all boats in order to address this problem. But childcare in our area is really a significant need. And the need is even greater when you're talking about early learning. This map is actually as of October 2023. And although the color is different, they actually changed the color so that we wouldn't feel as bad about it. But actually, the need for early learning childcare is even more significant than the need for school-age childcare. So in Clallam County, only 23% of the need for early learning childcare is currently met. When you're talking about infants, only 9% of the need is met. So again, for us as the Y, looking at what are the community needs, what are opportunities for us to address the gaps in our communities, childcare really rose to the top. It's not just an impact for working families. It is an impact for our community in terms of cost to employers. So if you're an employer on this call, I'm sure you're painfully aware of what the impact of lack of childcare is, not just on keeping staff, but on recruiting staff. But in our region, employers are incurring $94 million per year in compensation and turnover costs that are the result of people who are getting to work late or leaving early or who leave the workforce altogether because of a lack of childcare. Almost 3,000 employees each year quit a job because they can't find childcare, and 1,400 employees each year are fired because they're having challenges related to childcare. So this is a huge issue. And again, I'm sure pretty much everyone on this call is painfully aware of how significant the issue is. So what was the WISE response? What is the WISE response? Well, I was really fortunate when I first got here in this role to be part of a childcare partnership grant that Colleen and the EDC had served as a sponsor. So lots of us came together to talk about how we might increase childcare in our community, whether that was family home providers, license exempt providers, additional licensed childcare providers. And while having that conversation, I realized that our Y needed to figure out what our strategy was going to be. And so we came up with a growth strategy specifically related to childcare. It was our commitment to grow childcare based on demonstrated needs, based on determining a sustainable business plan. And I'll talk a bit about that so you can understand the complexity of the business plan related to childcare. Also, we did not want to grow childcare unless we had a means to assure quality. Quality childcare is incredibly important for child development. We also wanted to ensure, as we grew our childcare programs, that we were doing it in a way that would strengthen our community. And also, we knew to have a really effective childcare growth strategy, we would have to focus on workforce development. So let me talk a bit about the childcare business model, because I think this is important for people to understand, this is such a huge need. Why aren't more people providing childcare? In part, it's because the business model is really complex and it's difficult work to do. Nationally, the margin for childcare is only 1% at best. So it's a precarious business model to make it work, even though the need is so significant in our community. The first element of childcare that to me is incredibly important is ensuring that it's quality childcare. So in terms of, especially for early learning, 90% of brain development happens in the first 5 years. And so it's really important that kids are exposed and involved in really developmentally appropriate programs that focus on everything from helping them with their sensory pathways that involves vision and hearing to language to cognitive function. The first 5 years really lays the foundation, and it's the groundwork for helping kids start school ready and to be successful in school, as well as actually participating in a quality early learning program improves health outcomes. There was a longitudinal study called the Abecedarian Project that actually looked at what are the outcomes of a child being involved in a high quality early learning program in those first 5 years. And they found that actually, even in early adulthood, there were less risk factors, less drug use, less teen pregnancy rates, less depression, and into adulthood, lower risk of chronic disease, believe it or not. So less risk for heart disease, less risk for high blood pressure, less risk for obesity, all things that for the healthcare system we know are huge issues. So it's amazing those first 5 years, how critical they are, and having quality programs really matters. It helps set people up for success into adulthood. The return on the investment is really significant. And this is the graph that came out of a Washington STEM report that says for every dollar invested in early learning, there's a $7 return on investment. I've seen it as high as $16. For every dollar invested in early childhood, there can be up to a $16 return on that investment. So you can see it matters because it affects a child's trajectory in terms of school and their ability to enter the workforce and high wage jobs, helps them again, do better in school. So all of these things really have a significant return on investment. So quality is incredibly important. The next thing for working families is the affordability piece. Childcare needs to be affordable for our families. This is 2020 data, but if you look at Clallam County, the cost of childcare in Clallam County represents 23% of household income for a family with a child under the age of 6. That is more than the cost of college. So the target is 7%. Statewide average right now is 18%. So think about that. For families, they're really making a decision. Does it even make sense to work when 23% of our income is going to go to childcare? So this is a really critical piece for us to be thinking about in terms of our workforce, our economic vitality for this community. Lots of things happening right now, focusing on recompete, that's all about getting people back into the workforce. Well, affordability of childcare is a significant element in getting people back into the workforce, getting people to stay in the workforce.
So Wendy, question on that. The cost of childcare, is that before subsidies that the state provides through the Safe Stats?
Yes.
Okay. So
good question. So one thing that I do want to call out, like Washington State is working very hard. Actually, legislation was passed called Fair Start for Kids that is working really hard at increasing subsidy rates for families who access working connections for childcare and increasing eligibility. So more families qualify for working connections childcare. Anyone who is enrolled in working connections for childcare and is receiving state subsidy they've structured it so that they're not paying more than 7% of their income. So the state's done a really good job of, again, increasing the amount of increasing availability, access to more subsidies, more people qualify, and the co-pays for families end up being that 7% of a family's income. The one thing that I think is really important to point out, though, is right now, I talk about quality, right? I talk about quality childcare and how important quality childcare is. Childcare Aware has done a study in the state of Washington, and state subsidies to a licensed childcare provider equates to 47% of the cost of providing quality care. So they're working on shifting. Right now they pay based on market rate. They're working on shifting to reimbursing based on the cost of quality care. But if you were to look at what a provider receives for a state subsidized family, it's only 47% of the cost of quality childcare. So we've got a long way to go to close that gap, to make sure that all providers have the resources to provide high quality childcare. So thanks for asking that question, because it's a really important point to bring up, is what it means in terms of we need to address affordability of childcare for families, and we need to address for providers how to ensure they have the resources they need to provide quality childcare. So there's, we've got a few issues here to work on. So the next thing, in terms of what I would say the core elements of childcare, we have accessibility of childcare. We need to make sure that childcare is accessible. We need to make sure it's affordable. We need to make sure it's high quality, but we also need to address the workforce pipeline. What I'm really excited about, we have multiple groups working on increasing the availability of childcare in our community. So I know Steve Burke spoke last week about what Shore is working on in terms of adding childcare. Madrona is working on expanding infant and toddler care, which is amazing. We're working on it as well, but we need to have the workforce. We struggle with workforce just like everybody else, but we need to have the workforce in order to support increasing the availability in our community. So Washington STEM produced this really amazing report, and they talked about the need in our community when they looked at how many additional educators we would need to support early learning in our region, and this includes Kitsap, so it includes Kitsap, Jefferson, and Clallam. In order to meet the estimated need in our community, we need to add 600 childcare professionals. To me, that's daunting. And it's a problem we have to work on solving. So why is it such a huge issue? Well, if you look at the childcare profession, they're actually in the bottom 3% in terms of professional wages. And so you look here at what a childcare professional receives in terms of wages compared to a kindergarten teacher or an elementary school teacher, even a paraeducator. And I know that's an issue we're looking at right now, but childcare professionals are really at the bottom on the wage continuum. And so it's very difficult when you're talking about professionals who are required to, in most cases, have the same educational qualifications as an elementary school teacher, but there's this massive wage gap. So it's a gap we need to close. And yet, when you're talking about the ecosystem for childcare, we have to really focus on affordability for families. They can't afford to pay anymore, but providers who are in a position of 1% margin can't afford to make any less. And so oftentimes what happens is the last thing a provider can do is focus on thriving wages for their staff. Because if they pay thriving wages for their staff, they have to raise rates, which means childcare is no longer affordable. So this is a dilemma. It's actually, when I was talking to Representative Kilmer about it, he said, this is really like an economics case study. Like, how do we make this work? So this is why it's not just about opening up more childcare slots for our community. We're going to have to all come together to figure out how to make the childcare ecosystem work so we can make our community ecosystem work. So I just think it's really important to point this out. Again, the problem is really clear. Like, we need more childcare in our community, there are people out there that are working really hard to increase the availability of childcare, but it's a really difficult business model.
Yeah.
That said,
Wendy, so
yeah.
Amanda has a question for you. Amanda,
Great.
go ahead.
I'm curious how much the YMCA nationally or locally has done to engage with private employers and talk about subsidizing childcare from that end.
Good question, Amanda, and nice
Thanks.
to hear you on the
Thanks
call.
for-
You know, I think we have engaged the private sector from the perspective of, and our business model is fee for service and philanthropy. Again, you know, that is as a nonprofit, an opportunity we have is to get additional support from the community via philanthropy. But I think it's taken time for employers, and perhaps it became the employers became the most painfully aware of childcare during COVID. I think it's taken time to realize, like, oh, we all are going to have to work together to solve this problem. And I would say there's lots of room for opportunity for more partnerships with employers and childcare providers to make it work. But I don't think the gap with state subsidy at 47% of the cost of quality care, it's going to take a long time to get to 100%. We can't make it work unless we're also working with the business community to find ways to support childcare. So I think it's a conversation that is evolving, but has to continue in order for us to address this issue. We have to make childcare a viable business model to support all of the other business models in our community. But I think there's lots of opportunity there, and I would say lots of need there. So we're all going to have to work together to make this to make childcare supportive of the need in the community. So I shared our childcare growth strategy. We're really committed to growing childcare in our region, and we're committed to it with an emphasis on early learning. Again, going back to that graph in the very beginning where I highlighted how the Y has responded and addressed different things over the course of our 180 years. It is all about what's the community need, how can we solve that need, how can we close gaps. And childcare, again, out of COVID, became one of our #1 priorities. And so what are we doing? We're actually in the process right now of opening 3 different early learning centers throughout the Olympic Peninsula. I'm going to start with the bottom and go up so I can highlight a bit about what's happening specifically in Clallam County. But we will be opening an early learning center in partnership with OLICAP this fall. OLICAP built an affordable housing units in Port Townsend called Seventh Haven. In that facility, they also included space for childcare. So we'll have 2 classrooms at Seventh Haven providing care for 33 kids. So that is opening this fall. We also are, and Amanda Christofferson, thank you. We're working with Jefferson County, Jefferson Healthcare, the Port Townsend School District to build an early learning and family support center that will open next year that will provide care for 42 children. And then in terms of Clallam County, we will be opening an early learning center next summer as well. We will be building 8,000 plus square foot facility that will serve up to 96 kids ages 0 to 5. And let me just give you a little window into that facility. So it's really funny. I mentioned that childcare partnership opportunity that was taking place very early on during COVID, where Mary Budke, Steve Burke, and others, we were all talking about what can we do to solve the childcare problem in our community. And I kept thinking, oh my gosh, what if we could just find a facility to renovate or buy a building? And all of a sudden I had a light bulb moment and I thought, oh my gosh, we own on the same block as our YMCA facility in Port Angeles. We owned a couple houses. And I thought, what if we use that space and we built our own early learning center? Because one of the things about licensed childcare in particular, there are a lot of rules around licensed childcare and a lot of important elements to think about when you are designing a facility or going into a facility, potentially renovating a facility. And in many cases, it's actually more cost effective to build a facility. So I went to the board and I said, hey, what about this idea? What if we take a couple of the houses that we have and we look at building an early learning center? And lots of things lined up. And we are in the process now. We've actually, our conditional use permit has been approved. We have a building permit in under review right now. We are planning to build this facility that will again support almost, well, 96 kids. That's going to be right there on the same block as the Port Angeles YMCA. So our goal was to build a facility that would really feel inviting and welcoming and nurturing to our families. And I'm just so excited about this project, what it's going to mean to the community. And for me, it was really all about creating a facility that would feel to a family like a gift to them. Like our community really values our families, and here's this amazing place where they can come and bring their kids and know that they're in a really safe, nurturing, quality environment. So very excited about this project. And in the middle of raising funds. The project is going to cost, we initially thought the project was going to cost about 4.5 million. Then we thought it was going to cost 5.2 million. And any of you that are doing construction projects, I know you know this, but we are now looking at this project being about $6.8 million. We have raised to date just over $5 million, much of which has come from the state of Washington. Very grateful for the funding we've been able to receive from the state of Washington, and special thanks to our local representatives and senator because they have rallied around this particular project. Clallam County also made a commitment of $500,000. The city of Port Angeles has been amazing, very supportive of this project. We received a $500,000 gift from the Murdoch Trust, which anybody who's done a Murdoch Trust grant application, you know there's a tremendous amount of rigor involved in that. I'm very grateful for that support. Our board has made its own commitment. We're so grateful to have received funding from United Way and the Phillips Memorial Fund. So we're well on our way. And at this time, looking at breaking ground in the summer, in July. So that's kind of where we are. I'm going to stop sharing my screen and would love to answer any questions people might have.
Great. Thank you very much. So let's
Sorry
see.
about
We
those
do have
technical problems in the beginning, but we got it figured out.
That's all right. So we've got some items in the chat. Calvin says, amazing opportunity and partnership. Thank you, Wendy, for your leadership. Phyllis, do you want to ask your question or would you like me to read it out of the chat?
Excuse me, you can go ahead and read it out of the chat. Not really a question.
Okay. Wendy, thank you and all YMCA and your partners for having this vision and seeing it through execution. Quality, affordable childcare is the mortar that holds working families together, and working families are the economic driver of the community. Did not know about the multiplier effect of early childhood education. Fabulous. And then Shonda says, hi, Wendy, with the heavy gap in childcare for children with developmental and intellectual disabilities that are often identified in the early learning years, what supports, trainings, or partnerships are you identifying to support families having equitable access to childcare? Good question. Adding, will this new building be accessible to all under ADA and community needs guidance?
I'll answer the last question first. Yes, absolutely. And I think, you know, Shonda, nice to see you, hear you. There are a couple of things I think that are additional elements that we really need to think about and focus on in terms of childcare. One is, how do we make childcare accessible for everyone, including people who don't work traditional hours, you know, weekends? How do we address respite care? How do we address you know, cultural nuances? I think those are all really important issues we need to continue to address. Again, sometimes I feel like in childcare, it's like a fire hose, all the problems we're trying to solve, and they're not easy. And they add a complexity to all of the things we're already trying to just keep our head above water in terms of addressing the need for childcare. Again, I'm going to give kudos to the state of Washington for all the work that they are doing around providing supports for childcare providers, in particular for 0 to 5. There is Early Achievers. It's an arm of support for childcare providers that does a lot of coaching for providers, that has a quality improvement system that really helps providers continue to grow in their support of children with different developmental issues, with physical diversity. So there are resources and supports out there. Again, it's just a matter of balancing and balancing all of the different needs that are out there for childcare.
Right. Randy has a question. Randy?
Wendy, since you outlined the fact that we need about $7 million and we've raised a little bit over 5, I think, as of your slide, you might just address how we're going to get or close to be able to finish that, if you would mind. So,
yeah, well, first of all, I accept any and all donations. I'll just tell everybody on this call right now. We really do. One of the things, I don't want to be in a position where we're having to compromise on this facility. Like, I'm just going to work so hard to make sure my vision, again, is that people come to this facility and they just, it is the most amazing childcare facility. I still remember as a working mom what it felt like to take my kids to childcare for the first time. It's hard, and I want our families to feel so honored by the community that we all came together to rally to create just a really lovely facility. So we have a couple of additional grant requests out there. I just submitted a congressionally directed spending request to Senator Murray's office. But we will be launching a public fundraising campaign to the, going out to the community to get additional support. And this is, Amanda, to your question, this is an opportunity where our business community can step up and really support this facility with an investment. So it's going to take an investment in the facility. It's going to take an investment in our annual operations, but we need the business community support. So if anyone is interested in learning more about what our needs are specifically to close that gap, I mean, yes, $2 million, but we will be having a naming opportunity. So if anybody's interested, please reach out to me. Happy to share more details about that.
Great, thank you. Dr. Maxwell, and then also Pat had a question in the chat, I see.
Yeah, thanks, Wendy. I just want to say you just did such a great job so outlining the urgency of the problem and the impact on employers. And I think, as you know, and I think Colleen, as well, we were, a year and a half, 2 years ago, we were really in the midst of the pandemic. North Olympic, we were really feeling the impacts of that. We were losing staff because they just could not come to work because they had childcare issues to deal with. It was impacting our ability to just provide healthcare services. So reluctantly, North Olympic thought, well, there's nothing out there. We're going to have to try and home grow it. And boy, what an education that was. It is, as you outlined, it's a really complex, difficult process. It's not it was not in any way a strength for us. We have no knowledge. And so we were sort of stumbling forward, putting a bunch of grant requests because, as you know well, it's very expensive to do. And we didn't have the capital to do it. So we were looking for a bunch of grants. And we were not successful in our grant requests. And I almost feel relieved a bit because, as you outlined, it's a lot to do. But I felt most relief because I learned, in the process that the Y was moving forward with this project, and I think it's going to be a really great thing. Obviously the Y has a lot more experience. It's a strength for you, and it'll be a great thing for the community. And so, I mean, as you know, we'll be talking with you about finding ways of employer partnerships. It's expensive for the staff, and it would have been more expensive for us to try and build and run a facility than it is. Maybe we subsidize, as an employer, we subsidize some of the childcare for our staff as a more cost-effective way to ensure that. But yeah, so partnerships is going to be I think, an important part of it. I just got to thank you for really doing an important thing, and it's a great project. I just have to chuckle when you and Randy came to my office. I thought, shows how stupid I was. I thought you were offering me money for our project, and then I thought, oh no, you're asking if we have any. He said, no, we don't have any money, but I wish we did. But we'll try and figure something out. But thank you again.
So Pat asked an interesting question. Go ahead, Pat.
I'm curious to know how countries like Canada handle this, and do they have also extreme child care shortages for people? I don't want to get into political systems, but it just seems that we are always trying to invent new ways that other countries have resolved. So how do other countries manage this that are on our same kind of level?
Yeah, other countries invest in it like they invest in education. I mean, we just have this, it's really interesting. And Carlina, thanks. Nice to see you on this call. We do have a grant that we got from the Department of Commerce right now focused on creating a workforce pipeline. So we've been doing a ton of research on, the system, and that we just have this disparity in terms of investment in 0 to 5, investment in out of school opportunities, that it's out of scale with what we invest in the K-12 system. But all of it's all part of a child's development, and what happens even for school age children during out of school time and over the summer makes a difference in terms of their learning. Learning loss that happens over the summer for kids who are not part of a structured activity is more significant. And so each year they start school at a lower learning level than their peers who are in a structured program over the summer. And that disparity continues year after year after year. Kids who are in a quality early learning program in that 0 to 5 start kindergarten ready. They're ready to learn. Right now in the Port Angeles School District, less than half of our children start kindergarten ready to learn. And it's that lifelong impact, and it just perpetuates itself. It just continues. So in my opinion, we need to treat 0 to 5 care and after school care, out of school time care for school age kids as important. We need to value it as equal to the K-12 system, because it all matters for a child's development. for their success. But other countries do invest. They invest significantly in 0 to 5.
So Wendy, from some of the surveys that have been done, trying to understand why people are not choosing to be in the workforce, one of the items that came back frequently, as you've heard, is that there's not childcare for essential workers that are required to work weekends or after 5 p.m. Will the hours at the new facility be open on weekends or after 5 for those kind of workers?
Yeah, that's such a great question, Colleen. And I do want to acknowledge, like, it's going to take lots of providers in our region. You know, the Y is not the only solution. Shore is not the only solution. Madrona is not the only, like, we need to be lifting up the entire childcare ecosystem to help solve all the issues around childcare. To your point, Colleen, like weekends, evenings, and things like that. At this time, until there is a mechanism for additional resources and support for expanded hours, we're going to focus on likely our hours for the facility in Port Angeles will be something like 6:30 a.m. to 7 p.m. because it matters. We need to be, the business model, we need to be full. We need to be full in order to cover our costs. It's a really, like, the pro forma for childcare, it is such a hard business model. And when you get into things like evening care, weekend care, there aren't, the demand, although it is there, usually isn't such that you would be able to operate with full capacity, and there isn't enough subsidy to cover it. So we could explore additional hours, but there would have to be some kind of likely private funding mechanism to make that work. Childcare is very, very expensive to provide. It's very expensive to provide.
Yep, I know it. Well, are there other questions or comments from anyone? All right. Well, not hearing any. Thank you so much, Wendy, for coming and chatting with us today. You do an amazing job, and we're really blessed to have you in covering our 2 county areas. It's amazing leadership, so thank you. And I see Lindsay did put a link to a bill from Childcare Washington in the chat, so please take a look at that. And yeah, Carlina has been a great partner from the Washington State Department of Commerce, and the Prevention Works group has really organized things so nicely, bringing everyone together on a monthly basis. And the new leadership with Kim is fabulous. So I think we're really ahead in our region compared to other areas. As I talk to other economic developers across the state, we have won more grants and have really strong leadership in this space and have come a long way. And so that's a big thanks to a lot of the people on this call. So with that, I think we'll call it a morning and give you 4 minutes back of your day. So enjoy. Thanks so much, everyone.
Thank you, everyone. Thank you
Thank
so
you.
much.
Thanks, Wendy.
Thank you.